29th of June, we met for the first time face-to-face at Perkins in Monticello. I told her I was going to kiss her and ask her to marry me, and I said, you want that to happen in or out of the car? And she said, out of the car. So, and 5 days later, we were in Johnstone, Ohio, on the 4th of July, getting married. And it's been fantastic ever since.
We just really feel that God was in this all the way.
There's no doubt in our mind that he was also in this deal that just happened, because it was unreal. I was standing by the bed, kind of facing her. She was laying on the other side, and I felt myself falling. I called her. She came over and tried to get me up, and she couldn't.
His speech was slurred, and his mouth was kind of hanging open, and he couldn't move his left side. At that point, I thought, it's a stroke, and I told him I'm going to call 911. I thought, oh, how awful for him, and I began to pray.
He arrived about an hour after his symptoms had started. And within 10 minutes, they were calling our service and asking us to connect up and join into the stroke code process that was happening in the emergency room.
And the nurse said to me, he's had a massive stroke on the right side of his brain. And she said, but we have an expert here that's helping us. And I looked around and I didn't see anybody that looked like an expert, but it was on a screen up on the wall, and it was Dr. Hanson from Allina. I thought, gee, this is sci-fi.
Telemedicine is basically a video-audio connection from one site to another, oftentimes to offer subspecialty kinds of care in more remote settings where they don't have that opportunity. Where we have very little time, you can't wait for transfer to a metropolitan site or a larger hospital where the expertise is situated. Even at my own hospital here at United, we will video into our own ER to run a stroke code in order that we can be in there within 5 minutes and being part of the decision making and make that decision as rapidly as we can. Our goal is to be able to offer that treatment to the patient within an hour of them arriving to the emergency room. Every 15 minutes is a 5% relative risk reduction in mortality. Just saving 15 minutes is like adding another treatment on top of what we're giving them.
She was directing the nurse and the doctor. There was a doctor there, and she was telling them things to do.
I can take my own history, talk to the patient, and be able to connect with patterns of symptoms that are typical of stroke that a neurologist is good at discovering. And I'm going to have you smile, make a big smile. I'm looking for the symmetry on his face on either side. Raise your eyebrows up. Same thing there. And then look all the way to the right and look all the way to the left, watching eye movements to make sure the eyes are moving together. There are some subtleties that being able to touch a patient and feel the muscle strength and tone that I can't get, but I make substitutions for that in what I can observe.
She asked me how I was, and I don't remember what I said, but
I can tell you that we've worked with other hospitals where we had only a telephone conversation in order to make these decisions. And the decisions are not nearly as accurate. Same individuals on either side of the camera, same ER docs on that side and me on the other side. And I will be making much better decisions when I can have a video image and take my own history.
And she said, I think we'd better air flood him down here.
The IVTPA, when it's a large artery, is not always successful. So we have in the back pocket a second level of treatment that we can offer, but we couldn't offer it at the hospital that he was at.
So they call a helicopter, And the helicopter came right away. Everything was just like clockwork.
He arrived to us about 2 hours later. We were able to take him immediately to our angiogram suite. Our interventional neuroradiologists at our institution perform this procedure where they go in a large groin artery with a catheter, a tube, and thread it up to the carotid circulation or the posterior circulation of the brain. He received the penumbra device, which is an aspiration type of catheter system that basically sucks the clot into the tubing.
On Tuesday, they took me in for a MRA and found nothing. So it was a huge success.
Telemedicine saved him from a large amount of disability. With a stroke of the type he was having, there's maybe 20 to 30% mortality.
There's some movement over there.
It not only gave me back my husband's life, but I gave him back my husband so we could continue on as if the stroke had never happened.
We just take every day as a gift from God, and we have no idea how long it's going to last, but we thank Him every day for it.
It was a miracle.